To the organizers for inviting us to present our work. And we have nothing to disclose. I'm delighted to present these on behalf of our colleagues.
That was well done.
So we've heard a lot about aging with HIV earlier this afternoon, and specifically how aging can be associated with complications. Our group is interested in further trying to define cardiometabolic complications in youth with perinatally acquired HIV. So I like to show this graph because when we think about phenotypes associated with cardiometabolic complications, we often think about obese youth. And you can see on this graph, on the x-axis is the body mass index, and on the y-axis is the risk of cardiovascular disease. However, in youth with PHIV, what we've been finding is that they can be metabolically unhealthy despite having a normal BMI. Sometimes we refer to this phenotype as skinny fat. What do I mean by metabolically unhealthy? They're more likely to have adiposity in their trunk, which we know truncal fat is associated with an increased risk of cardiovascular disease. That fat is also associated with insulin resistance. There's a higher likelihood to have ectopic fat, so fat stored in the liver or skeletal muscle. And it's a little bit of a vicious cycle. Inflammation may drive the fat, and the abnormal fat may also drive inflammation. A lot of these studies were done by some of you in this room, and on kids that were on older regimens, so on PI and NNRTI regimen. Additionally, it's well known in adults living with HIV that inflammation can drive a lot of the complications that are associated with poor health span. There's evidence also highlighting the fact that despite viral suppression, youth with perinatally acquired HIV also have ongoing inflammation and immune activation, and that inflammation may be associated with cardiometabolic complications. So for the purpose of this study, we were interested in assessing body composition and metabolic outcomes in those on DTG compared to seronegative youth. In addition, we wanted to find out whether these complications were associated with inflammatory and gut biomarkers. Additionally, as I mentioned earlier, we're interested in trying to identify phenotypes, and for that we use cluster analyses to really visualize the distribution of each features. In addition, we used network plots to try to find out the associations between body composition and biomarkers. And lastly, we used regression models to try to assess the association after adjusting for potential covariates. So our methodology, this was a cross-sectional study at the JCRC in Kampala. We enrolled youth with PHIV between the ages of 15 and 25 years who were virally suppressed without any co-infection and on stable ART for at least 6 months. The seronegative participants were age and sex matched, were also HIV unexposed by history and without co-infections. Body composition was measured by a DEXA scan. Metabolic measures include fasting insulin resistance measured as HOMA-IR and a lipid panel. In addition, the biomarkers we included were systemic inflammatory markers known to be associated with complications in adults, and gut integrity and translocation markers, because our group has found that despite viral suppression, the gut integrity seems to be continuously dysfunctional. So the baseline characteristics, we enrolled 50 participants in each arm. They were about 16 years of age. Roughly 50% of the participants were female. You can see here the sociodemographic variables. There were really no different in terms of a youth with PHIV versus seronegative youth. We also measured nutrition using a dietary diversity score developed for Uganda by the World Food Program. It's a little bit easier than to do 24-hour recall. You can see that dietary diversity was slightly lower in those living with HIV. Physical activity, however, was slightly higher in those living with HIV. So if you look at those numbers, just to put into context, in general, youth with PHIV have 3 hours of moderate activity per day, And when you try to, everything is relative. On average, U.S. youth barely have 3 hours of moderate activity per week. So a lot of physical activity. They were virally suppressed by design on ART for about 13 years. At the time of the study, they had been on a DTG-based regimen for about a year and a half. And then significantly different biomarkers are listed here. So BDG is a marker of fungal translocation, and historically has always been higher in these youth in our cohort. IFAB is a gut integrity measure and also seems to continuously be higher in this cohort. So surprisingly, there was actually no difference in body composition as measured by DEXA, just a slight difference in upper extremity fat, but total body fat and truncal fat was not different. As I mentioned earlier, we're interested in really trying to tease out a phenotype that's associated with cardiometabolic complication. And so I want to highlight a little bit further what we found. We did find 2 separate clusters. In blue is the cluster 1, that's the larger cluster you see here, and in yellow is cluster 2. So if we dig a little bit deeper, cluster 1 is more likely to have higher total body fat and higher total trunk fat. When we look at the biomarkers, they're more likely to have evidence of translocation, both fungal and bacterial translocation marker. They're more likely to have higher CRP and higher soluble CD14, which is a monocyte activation marker known to be associated with higher cardiovascular disease. Lastly, the last 3 variables listed here were not included in the model for cluster analysis, but you can see that participants in cluster 1 had higher insulin resistance. There's slightly more participants with HIV in cluster 1, and significantly more of them were females. So we try to dig a little bit deeper in trying to understand the relationship between cardiometabolic variables and biomarkers. In light blue are the biomarkers, in light green are the anthropometric measures, and then in orange is insulin resistance. I want you to focus on these 2 associations. So body fat and trunk fat seem to be associated with beta-D-glucan, the marker of fungal translocation, and HOMA-IR with IFAB, the marker of gut integrity. So in our regression analyses, what you can see is that after adjusting for the covariates listed here at the bottom, total body fat was still independently associated with being female, with having HIV, and translocation and gut integrity markers. Similarly, trunk fat was independently associated with being female and fungal translocation marker. And then HOMA-IR or insulin resistance, again, similarly independently associated with being female and HIV status. So in conclusion, we find that in Uganda, teenage females have evidence of systemic inflammation, gut barrier dysfunction, bacterial translocation, and metabolic disturbances. These disturbances and biomarkers seem to be associated with body composition and insulin resistance despite viral suppression on DTG. This is very similar to findings from US cohort and the FACT study particularly. We know that this phenotype is associated with future risk of cardiometabolic complications and all-cause mortality. So future studies, we're hoping to try to tease this out a little bit more. We are longitudinally following up this cohort. We're planning for future immune assays. We have stool samples that are stored, so hopefully we'll be funded to do future microbiome analyses. And lastly, I think this group is well aware that we're concerned about complications and how youth with HIV can live long and productive life. And so should we think about interventions targeted at cardiometabolic complications, I think we'll hear more tomorrow in our pros and cons with Victor and Mosipele based on statins. So I want to thank the participants and their family, without whom this research wouldn't be possible. All of my colleagues at the JCRC, including Victor, who's here in the audience, everybody in Chicago, in Cleveland, Ohio, and the NIH for funding our study. And last but not least, she might hate me for saying this, but my teenage daughter is in the audience, and I'm really glad that she can see what international scientific collaboration is meant to look like. Thank you.